If you're 40 weeks or your due date is fast approaching and you don't feel at all ready for your birth, I've got you covered. I'm going to share some tips and some must-dos and really just cut it down to the shortest, easiest list. I'm Angie Evans, and I help all kinds of people prepare for their birth as a birth doula and as a prenatal educator. So if you were going to maybe go into labor tonight, what would you need to have done? And if you're not in labor tonight, just do these few things and you'll feel so much better about these final days and weeks. So the must-dos, the things that really need to be done before you go into labor. Just taking care of you. I know that sounds obvious. And if you're not ready now, you're probably too busy to take care of you, but really you can never go back and get sleep. So try to get rest, eat well, and stay hydrated, and continue with your prenatal appointments. The second thing, if you have children or pets at home, you need a plan for them. Someone needs to look after them while you're having your baby, unless you're planning to bring your child to the birth. By the way, this list is mostly for people who are planning a hospital birth. A few things will also apply to home birth. If you're working with a doula, you need to have their number in your phone and pack a small bag, even just a purse. Like here are a few things to put in there. Lip balm, hair tie if your hair is long enough to fall in your face, any prescription medications you're taking. You need a health card or insurance card, depending where you live, a little bit of cash or plastic so you can get some food, a phone charger, contact lens supplies if you wear contacts, and toothbrush, hairbrush maybe. You need to have something for the birth mom and the baby to wear home after. These are things you may or may not need, depending what your local hospital supplies. Diapers for the baby, one package should do. Disposables are easier than cloth diapers in those first couple of days. Mesh undies or some big comfortable undies to wear in the postpartum unit, 5 to 10 pair. Pads, good thick pads. You can get postpartum pads or something like this. You can also buy adult diapers that would cover both of these bases. Not pretty, but very effective in the postpartum. A peri bottle. This is the one our hospital provides. It's like a bidet in a bottle. You can also buy a fancy one. In my local area, the hospital provides all of this. You need a car seat if you're going to drive home. Just throw it in the back of the car. Don't even worry about it being installed. You can do that later. That's about it. That, like anything else, is icing on the cake. You do need your birth plan if you have one, and if you live in an area where you carry around your prenatal records, you need to have those with you as well. You need enough gas in the car to get to the hospital and back, and also a plan for early labor. In early labor, is there a reason you need to go to the hospital? Are you going to stay home? Make sure maybe there's some snacks there. Pretend you're not in labor as long as you can. That's it. That's what you need, okay? I'm going to share next some ideal things. Like these are things that are going to make your birth go more smoothly, or they're things that can be done right after the birth. You can make a short, sweet birth plan if you haven't done so already. And I've got a link down below for my article with just the basics of making a birth plan, but it can be super short. Hello, we are so-and-so. Put your names at the top. Thank you for supporting us. We would like to have a discussion so we can make informed decisions about any tests or interventions. That's it. That's all you need. You can have all like little things that are specific to you as well, but really that would be enough. A toiletries bag with maybe a little more than just the toothbrush. Knowing when to go to the hospital and how to get there, what floor to go to, things like that. I've got links for the hospital tour below and some things to know about the hospital where you're going to give birth. That applies to anywhere, not just here. A plan for the intensity of labor. I teach a class about how to ease labor pain. Basically, though, if you don't have time to do the class, in a nutshell, you've got natural hormones and helpers in your body. There are hormones to help labor move forward. There are other hormones that help with pain. They're actually natural painkillers. Stress makes those go down. and comfort makes them go up. So figure out what's going to make you stressed, what's going to make you happy, and obviously do less of one and more of the other. If you're working with a doula, they can teach you the comfort measures on the fly or do them for you. If you don't have a doula and you want just the very basics, go find videos to learn the double hip squeeze, counter pressure, and glute massage. Or you can just cram the easing labor pain class. And there's a link below for that. You want to ensure your baby's in a good position before labor starts. And I have an article about that you can check out as well. That will help your birth move faster and way more comfortable. You need somewhere for the baby to sleep when you get home. And seriously, for some people, it's a laundry basket or a drawer out of a dresser, a bassinet. I see a lot more of that. Just something where your baby can sleep in your room, ideally in your room with you. And you probably want a few baby supplies at home. Diapers, maybe a few clothes, washcloths or wipes, gentle soap, receiving blankets. And also, it would be nice to have a nursing bra. Bonuses, if you find, hey, we're ready, we're not having the baby yet. What's going on? We have extra time. That would be nice, wouldn't it? Then you could do the whole easing labor pain class. If you want like your dreamy birth bag, there's a link with a list of all kinds of things. That is not a to-do list. That is an ideas list. So go through and see what applies to you. You could do a hospital tour where you're going to give birth. And then maybe you want to have more of a birth bag that includes clothing for you to wear during your birth and in the stay after, if you're staying at the hospital after. Of course, there are lots of other things people do to prepare for their birth, but those are the essentials, especially that first section. So I wish you a wonderful birth, and you can do it. You can cram and get ready for your birth in very little time. Thanks for watching.